At first, when King's told me that my placement was at UCLH, I'll be honest, I'm not really from London, so I didn't have a clue what to expect. And there's just so many things to see, there's so much to learn. It gives you a taste of all the different opportunities there are out there in nursing.
I've been qualified for coming up for 10 years as a nurse endoscopist. It's an advanced practice. It's great when you diagnose a patient and you're getting them on the road to recovery. And once you stop learning, that's when I'll have my boots up, but I'm not ready yet.
I did my nursing training in the Philippines. I want to adventure, I want a challenge. So I joined UCLH because nurses here are more autonomous. I'm currently on patient emergency response and resuscitation team, identifying deteriorating patients or at-risk patients in the ward and helping them to manage it.
The point of what we do is to be an advocate for the patient. As I went through my career, I realised that I wanted to find more innovative ways of doing that. I'm a primary investigator of a study of patient experience in nuclear medicine. So we've developed interventions for people to help prepare for PET-CT and PET-MRI. You get the sense that you're doing something that no one's done before and no one's doing anywhere else.
We're called clinical systems designers. We were seconded out of our clinical roles so we could use our clinical knowledge in building a new electronic health record system. If you want to make a change, you need to be part of it, don't you?
I originated a standard technique called aseptic non-touch technique many years ago, now used in about 30 countries. I'm very proud of that, but also grateful that the organisation supported that work.
Critical care is surrounded by quality improvement projects, and that means that we're always trying to do our job better. If we really invest in staff, then we know that they'll do the right thing by patients. That's my joy in work, really, making sure that the staff are okay.
Came here as a first batch of Filipino nurses in 1999. The headache specialty fascinated me. I was able to establish the very first nurse-led multiple cranial nerve block service. And if somebody told me in 20 years you'll be a published author, published in international journals, I would have said, you're lying. Impossible.
My role is a trainee nursing associate. Going back to studying was a little bit daunting, but the confidence that I've gained, it's tenfold, and in 2 years' time I'll be registered nursing associate, and you can become a registered nurse if you want to.
We are an outreach service who specifically target people who are extremely vulnerable and socially excluded. There's no job description. It was literally building a service in response to need. We're never going to tackle tuberculosis, hepatitis C, HIV, unless we can reach those people who are most at risk. It's been an absolute joy and a pleasure to try and make a difference there, and I know we do make a difference.
In oncology, some patients don't have visitors. So we set up a board and busting trolley. And we have things like origami, art therapy. People pick out what they want to do. A lot of people seem a bit happier and it gets them chatting.
When I did my nursing, I was quite a mature student. Came to the UK, had the opportunity, I'm going to go for it. And I did it, and I don't regret my choices at all. When I do have my student nurses, I also say to them, you're in a brilliant career. Sky's the limit.
I was the first consultant nurse in multiple sclerosis in the UK. I've been able to develop clinical leadership skills, which has allowed me to influence care not just here, but nationally and internationally. I think nursing is well placed to push some boundaries. We just have to be courageous. We are natural leaders and we just need to believe that and make it happen.